Today we will be looking at a pathogen that causes a bacterial infection that is rather well known and widely perceived to be an inconvenience, but can sometimes lead to more threatening complications. And that is Streptococcus pyogenes, also called Group A Streptococcus, the bacterium that causes strep throat, a contagious infection that causes one to get sick. What are the symptoms of strep throat? As you're probably already aware, the most major symptom, the one that is literally in the name of the infection, is a sore throat. This usually comes on quickly and makes swallowing painful. Other symptoms to look out for are red and swollen tonsils that can sometimes have white patches, swollen lymph nodes, and tiny red spots in the back of the roof of your mouth. Those are the most unique and identifiable symptoms, but other main ones include a fever, headache, rash, body aches, and sometimes in smaller children, nausea or vomiting. Strep throat, if left untreated, and especially in immunocompromised populations, can cause complications such as kidney inflammation or rheumatic fever. Rheumatic fever can lead to painful and inflamed joints, a specific type of rash, or even heart valve damage. How is strep throat spread? This infection is contagious and often spread through fluid, more specifically airborne respiratory droplets, which are normally shot out of the body through sneezing or coughing, but even just talking can spread the pathogen. Sharing drinks and kissing also do the job. When someone is exposed to Streptococcus pyogenes, the bacteria rapidly reproduces within the person's system, and within 2 to 5 days, it'll make the person ill. During this process, the Streptococcus bacteria will first copy its genetic material. After the copy has been completed, the genetic material will then polarize at opposite ends of the bacteria. Basically the normal process of bacterial replication, but if you didn't know that's how it worked, that's how it works. If testing indicates that a person has strep throat, a doctor will prescribe a course of antibiotics, often penicillin or amoxicillin. These are drugs that can kill bacteria or stop their growth. Usually the timetable for the use of antibiotics will only be around 10 days. Of course, prevention is always the best way to avoid potential serious complications from any disease, or even just to avoid a minor annoyance like strep throat is for a lot of people. I'm not saying the pandemic is a good thing, because it is most certainly not, but it has allowed for wearing a mask to become a social norm. And in terms of preventing strep throat, wearing a mask is seemingly an effective way to keep these pathogens from not only entering your system, but also keeps you from potentially spreading them to other people. Also, it's best to try not to get up close and personal with everyone in public, especially during times of outbreaks. Around 11 million people deal with strep infections annually. It is difficult to find where and when recent outbreaks have occurred because it's an infection that's constantly spreading, and most people consider it just a minor nuisance. Although it does seem to occur more in the winter and early spring. A couple thousand people do end up dying from strep infections every year, so even though for most people it's not a huge deal, it is genuinely something to be looked out for if you're already dealing with immunocompromisation or other weakness. Thanks for watching my video. I hope you learned a little more about the pathogen that causes strep throat, and have a good day.